question today about whether naturopathic medicine can treat depression. This is another very complicated question because it really varies significantly from person to person. The first thing I'm going to say is please make sure if you're suffering with depression that you have someone that's worked you up properly, that's assessing on a regular basis, that's making sure you're getting proper treatment, and that you're not heading too far down. I think it's very common for people with depression to not realize that they're on a downward slide and to not reach out for help until they're too far deep in that hole. So please, if you suffer with depression, make sure you get the support that you need, whether it's counseling or having a friend to touch base with, a psychiatrist, a naturopath, someone who can kind of keep an eye on you other than you. As for whether we can treat depression naturopathically, we often can, and what that means is really finding the right balance for each person. Now, some people absolutely need medication and nothing we're going to do is going to make a difference. But the truth is that's the rare exception in my experience. Often when people have brain chemistry imbalances, there are things that we can do from a naturopathic perspective, or I should say from an integrative perspective, to help them feel better with or without antidepressants. And what that means is looking at the right food for them, looking at the right supplements for them, incorporating exercise, incorporating the right kind of therapy. And that doesn't necessarily mean talk therapy. It can be something like EMDR, which is a therapy that's being used of late for post-traumatic stress, but I've seen it be helpful for many, many different kinds of mental health issues, stress, anxiety, obsessive compulsive issues. The other thing you could do would be a body-oriented therapy. So don't think just because you've had a therapist that did or did not help you that there isn't further help. The supplements that can be helpful vary widely, and that's something that I wouldn't touch on a video, but something that a personalized recommendation could really help you with. But really, please, 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 don't stigmatize medication. There are people who simply need to be on medication because it's the best option for them. Now, it's not a great option to treat grief, for instance, although short term, it can really, really help get you through to where you need to be. But treating situational depression with medication can create a circumstance where it's very hard to get better and very hard to get off of the medication. So make sure whoever you're working with can really help you assess whether it's a legitimate biochemical imbalance that you suffer with, or whether it's a temporary situation based on your circumstance. There are also things that can increase your risk of depression. For instance, birth control pills and other hormonal contraceptives. We had a study recently showing that in particular for young people, being on hormonal contraceptives increase their risk of depression substantially. There are other things that can increase your risk of depression as well, such as not getting enough sleep, eating foods that are inappropriate for your body, having irregular blood sugar issues. So please work with someone who can help you get underneath and figure out what the cause is and be able to assess whether you're someone that really needs to be on a medication, and then allow yourself to do that if it's what you need, or to not be on a medication and to have the support that you need to get there. Please see my website, drsamantha.com, for other health information and topics that may be of interest.